Hello, everyone, and welcome to Mertz Taggart's inaugural Behind the Curtain webinar. I'm Cory Mertz, Managing Partner here at Mertz Taggart. We are a lower middle market healthcare services merger and acquisition firm that specializes in representing owners of home-based care companies. And so a big part of our value proposition is to help clients not just maximize the value of their agency, but get the best possible deal when they ultimately transact. And so a big part of our commitment to educating agency owners on building value, we've created this webinar series to kind of tap into the insights from some of the top home-based care buyers across the country who are actively doing transactions. So today we're thrilled to welcome David Jackson. David is the founder and CEO of Choice Health at Home, who will share what at least one strategic buyer looks for in an acquisition. We want to encourage everyone to submit questions by raising your hand down at the bottom of the screen. All questions will be kept anonymous, and we'll answer as many as we can at the end. So with that, I'll turn it over to my colleague, Michael Lloyd, to get us started.
Yep. Thanks, Cory, and thanks, David, again for joining us on this series. We look forward to doing a bunch of these. So thank you for kicking us off here. As I was looking at the attendee list, this all seems to be kind of working perfectly because we have folks all across the spectrum and, from people that are just getting started to folks that are probably at an inflection point, 10, 15 years past when we got their agency started. So I think that's a perfect segue to maybe let David jump off here and talk about just sort of the early years of Choice. We'd love to hear kind of how you got started, what your vision was at that time, and then some of those like early milestones that you hit, and give folks a little bit of insight into what that all looked like.
Yeah, no, I appreciate it. Thank you guys for having me. For those of you, some people know me in the industry. I started in this business as a physical therapist. My grandfather had Lou Gehrig's disease. I tell a story of like how nurses and therapists, a teenage boy, like my grandpa was this person who's larger than life. And so seeing them work with him, just endeared me to the industry, really kind of gave me a life goal of being able to take care of people in their home, enable families in times of crisis. And so go on to PT school, get my master's in physical therapy, come out, grandmother breaks her hip in a little bitty town, Palestine, Texas. And when I moved back, I was fortunate enough, small enough town to work in pretty much every segment of post-acute. It was a real opportunity for me, asked a lot of questions. And then really shortly thereafter, in 2007, I founded a rehab company that became Choice. And my vision for the business was always to be a diversified service business. So when we started the rehab company, we worked for hospitals, nursing facilities, home health care companies, even contract with hospice. And then very shortly after, thinking like a clinician, the ACA comes along in 2012 and entered home health, bought my first home care license. I left out the part, 3 credit cards, really bad line of credit. If you think about 2008, 2007, you're thinking housing crisis. It was probably some just gusto that I probably shouldn't have had, but took the chance. So entered home health in 2012, really just moved down the road, start another agency, moved down the road, start another agency. Entered hospice in 2018. We had begun, palliative care as a PT. It was one of those strange things where I'm like, hey, this is a really great advantage for our patients, work through transition. So we have the rehab company, home health, hospice. And then 2020 comes along, PDGM, PDPM in the skilled nursing facilities. And if you think about that journey, I'm like, oh, you know what? This is an opportunity. And I know we'll talk about this. I'm like, hey, let's recapitalize my business and take this opportunity that is a payer change. And I didn't have COVID on my bingo card for 2020. And so that made that a much more, dynamic experience if you kind of look at our timeline, but captured that opportunity. And we always had a vision of moving into personal care. So now Choice is a very diversified platform. Starting in 2007, 5 employees. Now we have thousands of employees. We service approximately 10,000 patients across 7 southwestern states in the U.S. And we have our three core product lines, which is home health, hospice, and home care. Very balanced portfolio. And then we have rehab, and I consider that like the three pillars, and then the scaffolding that runs through the business. And so that's what we're doing at Choice. Really excited. Our mission is to pursue excellence in healthcare for patients in the home, to enhance their lives through that pursuit.
Awesome. Cool. So, yeah, you mentioned you're, taking on that financial partner in 21. So we can certainly talk about that, but just in that sort of that first chapter, did you do some of the deals to build out those service lines yourself? And I'd just be curious, like kind of working through those deals before you had a financial partner, how that went or anything you learned from that.
You learn a lot. What's interesting about my journey is I actually had a failed recapitalization attempt in 2018, and I learned a great deal from that. The number one thing, as a clinician, you guys think like physical therapist. I went out and recruited some financial personnel for my business after that. I think one of the biggest things for sellers is, especially founders, understand your financials, be an accrual, know how much money you're making. You are selling a business. And we're also like, if you think about founders, so many of us are clinicians in this industry. And so understand that you need those type of personnel when you start thinking about a transaction so you can understand, the business of what we're doing. The other thing I always say is sometimes we think of financial personnel as being like, oh, they're not like us. They ensure stability so that you can take care of patients.
Right.
A good P&L and a good balance sheet is also to take care of patients for the long term, and that's our goal. And that's what should be our goal, is to create programs that persevere through the good and bad times.
Yeah.
So early on, I've done 48 healthcare transactions. I've done 20 since recapitalization. So I had a lot of experience before. I'd sold real estate, MOBs, skilled nursing facilities, service businesses in other sectors. And then had done, I think we did about 5 prior to, specifically in home health and hospice. Biggest thing is that personal guarantee with the bank,
Yeah.
and putting it on the line. And but the transaction process, I think sometimes you stumble around in the dark unless you pursue people that can really advise you as you move through it, which like you guys do.
Yep. Yep. Awesome. All right.
David, you mentioned the early stages, and what stood out to me, you mentioned that you really got into home health in 2012, and you mentioned the early stages of the Affordable Care Act. So it was really, if I look back at 2012, that was really a kind of a contrarian play at the time. As I recall, the market in 2012 was, for Medicare certified home health was not great because of all the uncertainty around reimbursement. I think the ACA initially had earmarked somewhere around 39 billion in cuts for home health, starting in 2014 through, the next several years. What made you decide to jump in at that time?
Kind of going back to, we wanted to have a diversified platform. I had hospital systems and nursing facilities saying, hey, we want you to help us with readmission. And the vehicle for that is home health. I still think of the 3 sectors, hospice, home care, and home health. Home health is such a viable vehicle for caring for people at the lowest cost of care in the environment they want to be taken care of. And that's how I thought as a therapist, as a PT. I was just like, if you want me to help someone be at home, this is the venue.
Yeah.
And so, quite honestly, Cory, I didn't even think about, I was a big reader of MedPack, and I'm sitting there reading MedPack. It's just like disaster, cover your head, put the umbrella up. And so, but I also felt like we had an advantage. We employed, our therapists were W-2. We had a great deal of control if you think about 2012. And so it made it really viable for us to enter the market. And overnight, we were extremely successful, especially BPCI, the bundles that rolled out in 15. We had the ability to really meet staffing demands that some of our competitors couldn't.
Mm-hmm.
Awesome. Cool. So, kind of moving along in the timeline there, as far as, you mentioned in the early years, you learned a lot, maybe had a failed transaction or two. And then, when the recap came along, you tell us a little bit about that journey, how you landed on, Tribe and Kotala, and then, a little bit about that process. There's obviously thousands of private equity groups that all seem to have, a ton of capital to disperse. So, how do you go about finding the right partner for your business?
Yeah, no, if you think about that time period, there was a lot going on in PDGM, um, and then COVID. For me, I had a specific concept that I wanted to execute on. I am in my 40s and I like what I do. I really enjoy the mission of our business. And so I had a very clear entry point, and I talk about this, like you should think about your goals. Like, are you looking for a full exit? Are you looking to keep going? Like, what do you want to do? And you should talk with people who can help you find people that will execute on your goal. Um, for people like me, had I gone through a full process and pushed the envelope at that time period from an entry point, I very likely would have been looking at balance sheet issues in 2022 because I could have pushed purchase price up, entry level for like, and you live with leverage the next day when you recap if you're going forward. So you live with the leverage you create. And so for me, it was really like I knew the entry point I wanted. Tribe, Connor Cersei, Brad Wigginton, those guys at Tribe took if you think about that time period, there was a lot of uncertainty, Q2 and Q3 of 2020. So they're being not a Horizon fund. So they're like, they had this vision of like, and Connor and I talked, Brad and I spoke, and we're like, we want to build this business. Ralph Manning also with Kotala had been in and out of the industry in some fairly large plays. So I wanted like that type of experience on my board. Ralph brings a lot of experience in the industry. And I said, well, I want to build a Southwestern business. And, here we are 4.5 years later, and I've built a Southwestern business. We've executed on the strategy and delivered. And I feel real confident about returning value to my investors and to our patients as we continue to grow. But that process for me, I did not enter into a formal process because I had a very clear, like, this is what I want. Yeah. And once I found that group that was going to do it, Dallas, Texas, I drive a black Chevy pickup truck, drive up to Dallas, meet with the guys, have a board meeting, so it was a really nice match. And that's how it worked for me.
Yeah. Yeah. Very cool.
Interesting. So it was an alignment of not only the individuals, but their model and the value that they can bring to choice, right? With their backgrounds collectively.
Yeah, their backgrounds, and then you have to ask the questions of how do you envision continued capital support, debt in future, what kind of access to credit, and understanding that. And I do think it's very important when you engage with funds to ask that, to say like, here is my vision for the business. Does this align? And ask the real questions. Does this align with what you want to do? Ask the questions like, what are the deficits in my business that you think I need to address in the first 6 months, 1 year? And that creates alignment. If you're not aligned, they're going to be your partners the next day. So it's just important to plan that.
Awesome. So going from, that recap and that experience, obviously, once that happens, it's, pedal to the metal. You mentioned your black Chevy pickup truck that you were probably had an initiative to go from there to just really take over the world and grow it, right? So can you talk a little bit about, like, from that moment forward, what your growth plan was and kind of what you were looking to do, what you did, and you guys were busy. So kind of how you evaluated some of those deals, and down the line, we'll get into kind of specific service lines, but just kind of that initial phase of jumping in and growing the business with a sponsor and a partner, what that looked like.
Yeah, I think about building sustainable healthcare model at Choice, and we want to be a diversified portfolio. So this first 5 years with Tribe and Kotala has been about putting the scaffolding up for the house. So if you're going to be, a $300 to $400 million platform and, go 10x, of revenue and earnings, you're going to need to put up scaffolding and infrastructure. So as CEO, my job is to recruit people like Jeff Krieger, Paul McMullen, guys from players that have been where I want to go with the business. And so my job was to build out the org chart. Trina Lanier, one of my co-founders, built out the sales organization. And then we were very focused at choice. And again, going back to like, this is our investment thesis. We wanted to be in the Southwestern United States. So we had this geography that we want to be disciplined toward. And I think sometimes when people will get out here and they'll just start doing revenue grabs and move all over the country. And I just think about that as a clinical operator, like how do you manage that business? And then also, what's the other thing? Who pays you? The Medicare Advantage plans, Medicare, like how do you create value for a payer? Well, that's regional density, like true, like multi-layered post-acute in the home. You're going to do home care, home health, hospice. We can do all of this for you in, say, Harris County, Houston, Texas. Like, what can we do there? Phoenix, Maricopa County. What can we do in Oklahoma City? And then the rural outlets to those cities. So we were going to be very disciplined in that. And like you said, we were very busy. We were not in personal care in 2020. And so I had already expressed to Tribe and Kotala, I want to search for a personal care platform. And now, we have a 9-figure personal care business that we've built out because just thinking clinically, I'm a PT. If I can get a patient a hot meal, help with their dressing, help with them getting to the physician, it just benefits the continuum. So at Choice, we were very disciplined in geography and we had a profile. And then in each sector, we had a profile for the businesses that we were looking for. I know we're going to talk a little bit about that. But I think staying disciplined to that and executing on building the scaffolding at Choice, because we want to put ourselves in a position to be a platform that can spring forward 2026 to 2031 in this sector is very exciting. You think about the cager in this sector, especially our 3 pillars. And then also the discipline of being in all 3 is there's a change in administration. I don't know if anybody knew that. Yeah. And policy shifts with administration changes. But if you're in 3 sectors versus a single sector play, which I think that's a fine investment thesis, but you're less susceptible if you have 3 sectors supporting your balance sheet P&L than if you're single sector play and somebody's stroke of the pen changes reimbursement.
Right. Right.
David, yes. I'm curious. I'm sorry, Michael.
Go ahead, Cory. Go ahead.
I know we're going to talk about value-based purchasing once we get into the home health piece, but I'm curious, at that point in time, you knew you wanted to have, the 3 legs of the stool, right? The home health, hospice, and personal care in each of the markets. Was the concept of value-based care, value-based purchasing at a high level, with the MCOs, was that a discussion you guys were having at that point in time? And curious to know if so, and if you're not comfortable sharing, I understand, but I'd just be curious to know how that's going.
Yeah, like value, you create value through quality in every sector. To be prepared, I tell everyone that's in this industry, no matter what size you are, if you're driving towards quality, you're driving towards value-based value. And so, our home health agencies, I believe our average agency is 4.4 stars. We're very successful in being able to move the quality initiative in home health. And in our Medicaid providers, we've been successful in rehospitalization prevention, addressing social determinants of care. And those are things that really going back to 2015, Cory, we were very early in the bundles, BPCIs, some of the other CMS initiatives, ACO. We worked as a downstream contractor. So that taught us and kind of provided therapeutic exercise for the muscle that is value, that creates value, and that's quality.
Yeah, I feel I haven't necessarily done the analysis, maybe some have, but I feel confident that there's a direct correlation, as you were talking to earlier, with the health of the balance sheet or the health of the P&L and the quality of the the agency and the star ratings. I'm sure there's a pretty strong correlation to how that, looks if you were to chart it out.
Yeah, absolutely, Michael. The alliance, if you look at NOC and HPCO, like the alliance, I'm gonna start using that more frequently.
I'm still not there. Yeah.
Yeah, they provide, I always tell people the financial management conference that they put on in Chicago is one of the best for operators. And what you find, to Michael's point, is agencies that have discipline around their P&L and balance sheet typically have better quality scores. They have better nursing satisfaction. They have better control of their patient outcomes. It's just like it's like control is more of a like organizational control is what we used to say in healthcare is like, do you have control of like your things are going to happen, potentially avoidable events with patients are going to happen. It's just like, how does your organization respond to that? And it is systemic when you start looking at financial control and quality.
Sure.
Yeah.
So the next topic here that we'll bridge over to is just kind of, we'll go the three industries that you cover and look at, I'm sure, on a daily basis. And for our audience in attendance, this is truly like probably some of the behind the curtain type of stuff. Like this would be a conversation that David and I would have, if he's looking for something, or we're, trying to understand where the buyers are in certain markets, for us to be able to fully represent our clients on the sell side. And I think just trying to understand where you look at these different service lines, what you look at for these businesses. So we'll jump right off with home health. I know you've talked a little bit about it, but just, do you mind giving us a sense of when you're evaluating a home health business, the 3 or 4 top attributes that you're looking at in a home health business that's kind of your top 3 or 4 priorities?
Yeah. Well, and we hit this a lot, but compliance, in this industry, compliance is an imperative. It's very hard to see that at first glance. But we will launch the compliance audit immediately following LOI. It will precede everything else because if there's a red flag there, it's kind of a no-go. So I tell people, understand the regs, show control of your organization. If you've had, if you completely blundered several audits, it's a very hard asset to sell. Very hard, buyers just can't go. And the thing is, and that's one of the things I think a lot of people misunderstand about investment in healthcare. We have to look at the quality and compliance piece because we can't finance things that aren't of quality. So I think sometimes when you see financially backed assets that are non-compliant, they have run way amok of their plan. It just is not. It's not something that like there is no boardroom where that's the top one of the top topics for me with my board is like the quality and compliance initiative. So that would be the top attribute. Really, at first glance, we're going to flash quality scoring. So your CMS reported data, especially in home health, see how you're performing. We're going to look at your P&L and see how it's organized because just like Michael said earlier, most of the time we'll have concerns initially if your P&L doesn't look appropriate, your gross margins are way off norms, and people are like, well, what is that? The Alliance provides a lot of data about what your benchmarks are. You should strive to hit them. If somebody's making way too much money, a really high margin, that's concerning for a buyer because we're going to need to normalize that. We want to see a normalized benchmark, and it's not something that can be continued. So organized P&L and balance sheet, quality data, and compliance are the top 3. And then we really assess like the owner's what the owner is doing in the organization. And just one comment I would say on that is like an absentee owner is a good thing if you're trying to sell the asset because like if you're the owner and everybody depends on you, it makes it really hard for me to go and you're just like I'm leaving, I'm going to the mountains or I'm going to the beach. That's hard for me. But if you are somebody that says, hey, you know what, I've just been doing this, I'm involved, I'm the administrator, I want to keep working, I like your vision. That's another way to sell the business, but then continue to work with us. So we kind of look at things from those 2 angles.
Okay. And you touched on it, not to put you on the spot, but I'll ask you. So do you have a margin structure that you like to see for a home health business? If you look at, revenue, gross profit, and an EBITDA margin structure that you look for?
I want the business to look like the market. People have asked me this, like, and I'll touch, since we're talking about home health, I'll talk a little bit about Medicare Advantage and Medicare. If you have 80 to 90% traditional Medicare in your agency, and the counties that you serve are 20% traditional Medicare and 80% Medicare Advantage, that's a mismatch.
Right.
So at first, when I look at revenue, I'm like, hey, does this look like the counties they serve? Does this look the same? And you should. Well, we should be striving to take care of everybody. Medicare Advantage, traditional Medicare. We need to lobby about Medicare Advantage, but that's a different webinar. But so that I want to see the breakdown of the revenue. And then when you think about margin profile, your direct care costs, and so you should very clearly articulate your gross margin. It's shocking how many people will send initial financials and there is no gross margin delineation. It's just everything's put together. Who are your office staff, who's your non-office staff, and $2,500 a month is a high end to a good accountant to organize your stuff. You can literally outsource that. So I always encourage guys, if you're planning on selling the next 2 years, go engage an accounting firm, like get online, find out somebody that does healthcare and say, hey, I want to see my gross margin. Like get your financials put in accrual. They will help you. And again, as clinicians, it's so foreign to us because we're just like, accrual financials versus, cash. So do that. I strongly urge people to do that. And so from a profile perspective, I want to see that separated out. And I'll tell you, Michael, that gross margin to me in home health and hospice and home care is more important than net margin.
Yeah.
Because I'm a strategic buyer.
Right.
And I know what goes down below the line. Right. But if you're taking care of your clinicians, that's really important to me, because if that number's too high, you're not taking care of your clinicians.
Right.
And if it's way too low, it's very hard to change.
So you want
that. Yeah, you want the benchmark. You want that. And as far as profile, we want it to look like the benchmarks. Forbes, formerly BKD, they do a great job of that. The Alliance can provide some training with that. I won't get into specific numbers.
Yeah, awesome. Perfect. No, that was great. Thank you.
You mentioned one thing, David, that caught my attention. It was the mismatch, right? If the agency, you're looking at an agency in a market and they're doing 90% traditional Medicare, whereas the rest of the market is 90% Medicare Advantage, there's a mismatch there. I would have, to be candid, I would have looked at that and said, well, that's, they're doing something right. They're able to attract these Medicare, they can pick and choose who they take. I'm curious to hear a little bit more about that mismatch and how you guys, how you would look at that.
Yeah, that's really, something. I love home health. You mentioned contrarian, and I know home health is a difficult market choice. We're very successful in home health. We're very successful, and our goal is to match the market. Like, if you can be successful with Medicare Advantage payers in this world, like that number is only increasing between now and 2040. I mean, it's just a ramp. Traditional Medicare, I love the benefit. I think it's, my parents have traditional Medicare. And I think that, but the issue a lot of times, Cory, is how do you preserve that over the long term, especially when the seller is moving on? This is a relationship business, and what you can count on is matching the market. A slight, somebody's doing slightly better than market, but it's really like when you see these significant variations. And I can tell you, like, some larger businesses that have had this problem, because it's just hard to envision, preserving a big deviation from the global market, especially if you're trying to be scale.
Right. Okay.
Similar concept to, normalizing that gross profit margin if it's too high, right? Like it's going to come down to reality of the, settle across your entire organization, and same with the market in which the agency lives once it's, trades.
Absolutely.
Interesting. Okay. So let's see. Talked about home health. We'll talk a little bit about hospice. I know
Can I, I'm
yeah,
sorry, man, if I
yeah.
could jump in, I've got one more specific question for David, and it revolves around HHVBP. How do you look at an agency nowadays? Now that we're, in the thick of it, in terms of potential upside or downside reimbursement, if you're looking at an agency that, is going to, or is in the midst of a 5% bump because they're performing so well, that's great, right? That just says a lot about the agency, but from a valuation perspective, how do you look at that?
Oh yeah, I think it kind of goes to that quality marker is what we would have looked at prior. Your quality data is very important, especially if you use strategic health partners. So SHIP, if you have like your real time data and our CMS data, like we'll look at it from those two angles. So that's really how that ties in, Cory. Like we're looking to see, okay, how have you been managing your QAPI to move toward that? Now, the good thing about choice at this point in time is like we know our processes and how we educate on quality and what we're going to try to address. So that is something that we can manage to a certain extent around. We just want to see like, okay, from a cultural perspective, how have you been achieving or not achieving that goal? Um, and that to your point, I think the value-based purchasing initiative is going to further ingrain the need to find quality agencies.
Right.
So if you're out kicking coverage on margin, but not doing well on quality, that's kind of a bad combination. If you're with the market on margin and you're, addressing quality, that's a positive. That's a reason for us to be a little bit more aggressive.
Awesome. Yeah, that was one of the questions kind of in line with each service line is something that would command a premium. So any indicator on a home health business that would command a premium. It sounds like, quality scores is something that is important to you guys in choice. Is there anything else that jumps out at you from a talent personnel perspective or anything like that?
Yeah. The personnel that are going to come through the transaction, that's really important to us. I'm an operator at heart, I've de novo ground up accredited agencies, done, so finding people that can do that. And I say that all the time at Choice is like, we want people that have operated. So the talent that's coming across is really important. The quality data is really important. Uh, Nurse retention is a common question that we'll look at. I will say this: density also drives value, probably more so than a lot of other factors. If you have, this kind of I'm going to get over into the hospice question. I think during some of the froth in like 21 and 22 in hospice, you saw people with lots of small agencies saying, we've got 500 patients, and they didn't have a single license number over 65. You know, um, Now it's really about patient density because that drives nursing satisfaction
Yep.
and allows you to work with payers a little bit. So we'll look at, say, an asset in Las Vegas, Nevada that's performing in top 5 Trella, looking at Trella data, market data. That's much more valuable to us than someone who's much lower down from a market share perspective. So it really starts to become about available market share and like how you perform against your peers in market share.
Which sounds like in the density game, those metro markets are valuable to you and part of your strategic, mission here and strategy because you can build the density easier in metro markets, right? Or I mean, I know it's not easy, but the challenge with the metro, outweighs the ability to build density in those markets. Is that what you're?
They become hubs, and I think when you think about metro markets, rural markets also. I come from the pine trees of East Texas.
Yep.
Tyler, Texas is our corporate headquarters. And Tyler is a great place to found a business. I'm so thankful to so many people in that town for helping us as we launched and continue to grow. But if you think about the metros and the way Choice has always looked at it is you have this hub in a metro area, and then 1 hour out of town, you'll start looking at the feeder cities, and then you can spur off of those. And those metro hubs, just like every other industry, provide an opportunity to provide great healthcare, both urban and rural. And this morning I have a call usually looking at like healthcare deserts with some of my team members, and we're like, how can we service this community? How can we find staff to service this community? And so we really want to look at both, but obviously, like an urban market, major market share would drive a premium.
Gotcha. Cory, did I cut you off earlier? Is that where you were? I thought you might be going there with that question too. So yeah, we've seen that a little bit of a shift in that. I mean, there's less competition rurally, right? So those have always been interesting, and just from serving the patients, they're underserved markets oftentimes. So I think folks like you appreciate being able to get to some of those rural areas and serve, patients that aren't traditionally served by quality, or there's an opportunity there to do both things. So yeah, well, maybe we'll shift to hospice a little bit, same general concept here, what are the things that you're looking for in hospice? I maybe, you happen to operate in some of the markets in hospice that have this enhanced oversight, initiative that's currently, a factor in M&A. So maybe you could talk a little bit about that across Texas, Nevada, California, New Mexico, or the enhanced oversight states. Arizona,
Yeah.
right?
No, I mean, absolutely. Yeah. What a tremendous benefit, hospice. I mean, it's just like it's one of the better benefits in the Medicare, traditional Medicare portfolio of benefits. And the I think oversight is really, really important. I will say, like, touching on AI, you can't go through a webinar right now without saying something about AI. AI is going to really enhance the ability to run a successful agency in home health. It will enhance operations. The biggest opportunity I see for AI in hospice is working on regulatory compliance. AI can scrub your charts. I mean, there's a real opportunity there. We're excited at Choice. Like, okay, we could screen 100% of all of our charts for ensuring that every patient meets the benefit criteria. We can help improve the quality of documentation from our nurses to enable them to take care of that patient. And when you start thinking about enhanced oversight, that's where I love review claim demonstration in home health, the RCD, because it just makes everyone more compliant. In home health, it's really hard not to be compliant right now in an RCD state. When you start thinking about hospice, there is no pre-claim review process, or there isn't in post-transaction, but in general, so you don't have the same mechanisms to ensure front-end compliance. And so at Choice, we started, about a year and a half ago, we do pre-claim review in hospice on ourselves. And I think everyone in the industry, that is the biggest, to your point. I mean, I love that you entered that and came in with that, because it is the most audited sector right now. And I feel like that AI is going to give us an opportunity to really improve as an industry, which is important because there's just so many good players. I mean, people will talk about bad actors. There's so many good actors in hospice, tremendous benefit. But that's where I see an opportunity, be better in compliance. But it is the most significant component of a transaction right now.
Yeah, I think you all but said this, but when we look at kind of home health and hospice, the home health groups seem to have been under this compliance scrutiny for years and years and years. So they're kind of used to that, scrutiny on the compliance side, where it seems like that's catching up on the hospice side. And, in some ways, maybe like they're not as used to the scrutiny that's going to come on the compliance side. So the home health operators are probably, I don't know, 5, 10 years ahead on that compliance scrutiny to the hospice. Does that ring
You're
true?
100% accurate. Yes,
Okay.
it's very like that industry 10 years ago. Home health was just where you saw a tremendous, and now audit is so ingrained in home health that we rarely see issues with our home
Right.
health that comes in there. Whereas on the hospice front, it's much more tedious process. I'm hopeful as I love the TPE process, Target Pro. I think it's probably CMS best audit tool because they'll audit and then provide education. And I just think that's really, well, like I said, there's a lot of people in that part of the industry that are very dedicated to patient care. And so Targeted Pro is great because it's like, hey, you didn't do this right, but let me tell you how to do it right, make sure that you're doing it right in the future. And so I feel like the industry is going to come along. I think AI is going to give us a real opportunity to improve. But you're right, it's shifted.
Yep. Right. Okay. And I have to imagine that's where, as far as like red flags or deals falling through, and what we've seen, maybe you've seen as well, is on the hospice side, it's typically that compliance piece, right? So
Yeah,
it's trickier to bring something across the finish line and with compliance issues,
yeah.
especially
For
in
the
states.
Yeah, for the buyer for sure. Like the compliance is the number one hurdle. The second hurdle would be a big surprise in the financials, and that's kind of we've already touched on that. Is like if you really know how much you make, there's not going to be a surprise there. But if you're in cash and you're kind of like, I think I'm making this much money, and as a seller, like I think like, hey, do I need to go get outside help? My strong vote is get outside help. You should know the answers to that. So it's compliance, then a financial disruption, something comes out in the QOV, and that'll crash the deal just because it's hard to overcome from a financing perspective.
Sure. Okay.
Yeah, and
So
we mention all the time, certainly to our prospective clients, especially in hospice, to do a billing audit, before going to market. So, and I think a lot of folks don't understand that there's a pretty significant difference between a billing audit and a survey, right?
Yeah.
A state
Yeah.
survey. Just because you pass your state survey with flying colors doesn't mean you're going to pass your billing audit, unfortunately.
Yeah. Survey, it's a big gap. Yeah.
So, just looking at the clock, I want to make sure we have plenty of time to talk about personal care as well, which is the third pillar of choice. Non-medical home care and all the shapes and forms that comes in, right? So, I guess to jump off, I'd ask you, as we've had conversations across, the industry over the past couple of months, just what you see as far as some of the headline risk with this Medicaid uncertainty, with reimbursement on the Medicaid side, and maybe even how that trickles down to the VA and how you're looking at those opportunities.
Yeah. We will at choice we were going to persist in all three sectors regardless. Inside of our personal care arm, we very recently acquired Family Tree, and those guys, Daniel, Alex, built a tremendous business. The team there were super excited. But with that, we're roughly 60-40, 60% Medicaid and 40% private duty inside of that personal care sector. And this is an example of what I said earlier about choice is, so this is a single sector threat, Medicaid regulation change. But when we look at our total book of business, smaller percentage of revenue. So we're very excited that we're diversified when something like this happens. And it could happen in any sector, but this makes choice a really balanced asset in that regard. How I feel about it is I think, and most people in the industry talk about this, um, the actual people that we are taking care of in the home, the elderly population in the home, very little threat to that particular benefit. There will be some eligibility requirement and things that come into play, but when we look at the people that we're taking care of, that vulnerable population, 70 to 90 years of age, they are not the people that are going to struggle with qualification components. And we need to be prepared to help them, ensure that they fill out their paperwork properly. How can we make sure that people are taken care of in our communities? And I say that as a community member, not as someone at choice.
Right.
So like, how do we do that? Ensure that social workers are aware of what's going on, and from that particular perspective. And I think most people in the industry, when you start talking about the really large players in that sector, feel the same way. It's going to be a little bit more about physician access and not so much the post-acute in the home, and provider access at the hospitals for persons under the age or outside of the demographic that we care for. That being said, $880 billion is a lot of dollars to figure out where you're going to get that from. But that's why we'll continue to be diversified. That's why we're excited about, the private pay segment that we have in our business in that sector. And we want to continue to work as best we can inside of whatever pay structure that the federal government and states hand to us.
Absolutely. Yeah. And you mentioned this earlier, and I this is sort of my optimistic view, of course, of the personal care side and the concern around the reimbursement risk is I think ultimately someone is going to raise their hand and be like, well, wait a second here, guys, like the spend here is actually saving the system money versus eliminating, these programs that ultimately patients will end up back in the hospital and costing the system more money. So, you mentioned that when we were talking about home health, but do you think the same applies? And are you guys able to quantify sort of some of that across your portfolio as far as the readmissions?
We've absolutely, our instant care platform in Arizona has actually participated in some of these. Oliver Folks, Blaine Carr, operating that business out there, great guys, and their team did an outstanding job in Maricopa County preventing hospitalization to Medicaid persons that we were caring for. And I think when you look at the social determinants and like how personal care, I allude to like the clinical just mindset of myself as a PT. We can impact probably just as much as the healthcare components. Assisting with those basic needs can keep people out of the ER, ensuring that they get their meds. Think things that we sometimes take for granted in our 30s and 40s.
Sure.
Yeah.
Well, thank you for that. Cory, do you have any questions that you were itching to ask David, or should we?
Well, I guess the one question that I do have for David, and this may sound self-serving, or it could go horribly against me, but David, you've looked at a lot of transactions. You mentioned you've completed 20 deals with your current financial sponsor. That's a lot of transactions over the last 5 years or so. I'm sure some of them, you went through a process with an advisor or a banker, and some you may not have. Just curious how you look at transactions when there's an advisor like us involved, and you can be positive and negative.
Yeah. No, I get it. So I'll talk to founders first. You spend your whole life building this business that you're so passionate about. Getting an advisor to help you divest the business or find a partner, I would advise that. I was fortunate in that I, real clear vision, knew what I was, but I mean, if you think about the number of transactions I've been involved with, I'm a little abnormal in that. So don't take that as like, oh, DJ did it, I'm going to try to do that. I would say use an advisor, and that's just founder to founder. So stepping back as a buyer, one thing, Cory, that I think, we have been second or third in a process before. I think 3 times we've been second or third and been the actual buyer in the end. So I think like one thing an advisor will do is, when one of your buyers starts acting, you take a deal and all of a sudden it starts getting retraded. well, I have this group here that they were very, confident in their bid. They're funded buyer. They'll keep that organized for you. You can manage it and say, and know when to say, hey, this is not normal from a buyer. So that's where that comes into value. Um, I will say, we kind of look at it, there's different advisors in the industry. And there's groups that will, you know, not all advisors are created equal. And so I think, groups that have been in the industry for a long period of time, groups that have been involved in the industry for a long period of time, ask questions, say, hey, can I talk to sellers that have worked with you before in the past? And I think that's really valuable. I would say that not only about the advisor, then also legal and then finance, like make sure you have those three in your court to help you present a solid product. I don't, we've done proprietary and we've done working through advisor. We have a very clear buyer profile and it doesn't change a lot about how we bid on a business. So the competition thing doesn't really bother us as a buyer because we're like, we send you an LOI, you guys, like, when we send you one, that's going to be our bid, whether we were the only one at the table or not. That's just kind of because we always assume there's probably somebody else bidding, even in proprietary. So, um, but my advice to founders is that particularly, and then the other thing that an advisor can help you on, and I think like you should start 12, 24 months out is just prepping. It can really organize a deal. Sometimes when we're proprietary, it's really hard because the seller doesn't know what's normal for us to ask for or what's market, and we have to really step through explaining those things, so it can be more difficult.
So yeah, you touched on that piece, like, having a queue of folks that are interested in your business is definitely helpful because like, the top bid from a dollar perspective, there might be a reason why they're, thinking they're going to overpay for a business. And it's nice to have, a fallback. And it sounds like, everybody does that differently from a buyer's perspective. But you guys sort of have your thesis, what you're looking for across the service lines, what the values are, and that's always a quality buyer to work with that's committed to not overpaying, but they have a focus and a commitment on their value structure and how that looks, and not being all over the map as far as value. So that's always a good sign.
Yeah, I think if the seller, we want to, at Choice, we want to be real confident in our LOI. If the seller produces like, hey, we have these financials, we have this quality data, we're compliant, we want to execute on our LOI. But sometimes, and that's where I think an advisor can really come into play. To your point, Michael, is like whenever there's times whenever we know we lost a bid and we're like, we're going to stay around the hoop because whatever that bid was obviously like was in a different ballpark. And I'm just like, they don't get there. That's not going to happen. And some
Right.
advisors, that's why I say interview your advisors, because you want somebody that can say, hey, that's probably a not safe bid.
Right. For
Yeah.
sure. For sure. We've definitely experienced that in the past. We try to, advise our clients on like what we think market is, and if there's something that exceeds it on either end, it's you scratch your head a little bit as to why, and if you feel really confident in what that looks like.
Yeah.
Uh, so, all right. So just a few minutes here to wrap. I would ask you kind of going forward from today into, the rest of the year or beyond, like what's your focus as far as service line, what, you guys are going to be doing, anything exciting, and then I'll wrap it from there.
Yeah. We're going to continue to be active buyer.
Yep.
We're building. I'm 48. I'm gonna say how old I am right on this webinar. 48 years old, and I love what I do. Like I said, we're putting the scaffolding up. We have this foundation. We're going to continue to build this business out for the next decade. And as I think about that, like we're interested in all three sectors. I will say this year, specifically, we're probably more focused in home health and home care. And so like we're active in those two sectors. Um, and again, we're still really kind of intent on the southwestern U.S. But we'll look at businesses in outside of that region. But we really want it to be in that area. We try to stay disciplined. So excited about that. We've got some really cool things going on as the businesses start to get interplay with each other more and more. Like I said, we're welcoming Family Tree, Devotion Hospice, and Conroe have been great additions culturally. Just really enjoy working with them. And at Choice, like empathy and being a good place to work is like one of our main goals. So if people are founders out there and they're like, hey, we want to keep working with people, but we would like to take some chips off the table and go back to not having to stress every day. We're a good group to work with.
Awesome.
That's great to hear. You know, we've got just a couple minutes here for some questions that have come in. A lot of them I feel like we've answered, and I'm not going to put you on the spot with some of these questions, David, but here's a softball for you. Are you still given the Family Tree transaction, by the way, congrats. Are you still looking to buy private pay in the Houston market?
Oh yeah, and Daniel leads that entity and side of the organization. We're looking to buy private pay, and then Lane and Oliver and Daniel all are looking at that Medicaid as well. So we're looking at both private pay and Medicaid in the home care segment. And again, just interested in looking at those businesses here in 2025, especially.
Awesome.
There's another question here. Looking at buying a home health company, but they are all private pay. They do not take insurance or Medicare. How do I evaluate this company for purchase? And I know who this is coming from, and I'll try to field this one. It's not in your geography, David, so or one of your target geographies. And I would suggest let's talk after this. Always, we're always happy to be of service any way we can.
Yeah. When we talk about private care, we didn't talk about this, but the compliance side is more around labor, so it switches to labor compliance.
Yes.
And are you managing that? So, I mean, I know you guys will tell them that, but that's the compliance in private pay is, and there is some nursing compliance and regs states, but definitely around labor.
Yeah, that's the big deal killer on that side, right? It's are you paying your caregivers, appropriately? Are you compensating your staff appropriately, offering the appropriate benefits, et cetera, et cetera? And it's a lot to stay on top of, even state, right?
And it changes by market too. So by day, by market, it seems. So
yeah, absolutely.
Yeah. So all right. Well, thanks everyone for joining. Looks like we're wrapping on time. We'd be happy to connect anyone with David who's on the call, and you can reach out to any of us at any time if you have additional questions. And we will, if we missed any questions in the Q&A, I'll save these and get back to you with some answers as we can. So thanks everyone, and thanks David for joining.
Thank you guys. Appreciate it.
Appreciate it.